Worn out mattresses can cause pressure ulcers and infections. Performing regular mattress audits can help reduce the number of healthcare injuries. Please use our protocol when performing your mattress audit. You can download it for free on our website. Adjust the bed to a suitable working height. Remove the bedding. Label the mattress. A suggestion is to attach a ribbon to the mattress handle. This makes it easy to see which mattresses have been inspected. Begin by localizing the date stamp on the cover to identify its age. Open the cover and localize the date stamp on the foam. The cover might have been changed, meaning its age might be different compared to the foam. Are there holes, stains, or other visible damages to the cover? Stretch the cover to look for outer damage and check the function of the zipper. Lift the cover, preferably in backlighting, and inspect the inside. Are there moisture, stains, holes, or other visible damages? Inspect all sides of the foam. Is it possible to feel the bed base through the mattress? Sometimes it can be difficult to feel if the mattress core has lost its function. Cup your hands and use your body weight to push your hands into the foam. Begin at the foot end of the mattress and work your way up. Usually the mattress loses its function over time. This often happens at the middle of the mattress. Are you unsure if the mattress has lost its function? Compare to an area about 20 centimeters from a corner. Since this area isn't used as frequently, the function is rarely affected. Finish the inspection by reattaching the cover. If the mattress needs to be replaced, it is important that it's noted in the protocol.